Hello, everyone. Now let's start learning about the muscles of the thigh. The thigh muscles are divided into the anterior group, posterior group, and medial group. First, let's look at the anterior group. 1. The sartorius is the longest muscle in the body. It is shaped like a flat band. It originates from the anterior superior iliac spine. It runs obliquely downward and medially along the anterior surface of the thigh. It terminates at the medial surface of the upper end of the tibia. Its function is to flex the hip joint and the knee joint, and to internally rotate the flexed knee joint. The quadriceps is the largest muscle in the body. It has 4 heads, namely the rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. The rectus femoris originates from the anterior inferior iliac spine. The vastus medialis and vastus lateralis originate from the medial lip and lateral lip of the linea aspera of the femur, respectively. The vastus intermedius is located deep to the rectus femoris, between the vastus medialis and vastus lateralis. It originates from the anterior surface of the femoral shaft. The 4 heads form a tendon downward that surrounds the anterior surface and both sides of the patella, and continues downward as the patellar ligament. It terminates at the tibial tuberosity. Its function is a powerful extensor of the knee joint. In addition, the rectus femoris can also flex the hip joint. Next, let's look at the medial group. There are 5 muscles in the medial group. They are located on the medial side of the thigh. All of them originate from the bony surfaces such as the pubic ramus, ischial ramus, and ischial tuberosity around the obturator foramen. They are arranged in layers. 1. The pectineus is a short, rectangular muscle, located medial to the iliopsoas muscle. 2. The adductor longus is a triangular muscle, located medial to the pectineus. 3. The gracilis is a long, slender muscle, located at the innermost side. 4. The adductor brevis, short adductor muscle, is a flat muscle similar in shape to a triangle, located deep to the pectineus and adductor longus. 5. The adductor magnus, adductor major muscle, is located deep to the aforementioned muscles. It is large, thick, and triangular in shape, except for the gracilis, which terminates at the medial side of the upper end of the tibia. All other muscles terminate at the linea aspera of the femur. The adductor magnus also has a tendon that terminates at the adductor tubercle above the medial epicondyle of the femur. A hiatus is formed between this tendon and the femur, which is called the adductor hiatus, through which the femoral blood vessels pass. After learning about the anterior group and medial group, let's look at the posterior group. The posterior group consists of the biceps femoris, semitendinosus, and semimembranosus. All of them originate from the ischial tuberosity, cross both the hip and knee joints, and are often called hamstrings. 1. The biceps femoris is located on the lateral side of the posterior thigh. It has 2 heads, a long head and a short head. The long head originates from the ischial tuberosity. The short head originates from the linea aspera of the femur. After the 2 heads converge, they terminate at the fibular head via a long tendon. 2. The semitendinosus is located on the medial side of the posterior thigh. Its tendon is long and slender, accounting for almost half of the muscle. It terminates at the medial side of the upper end of the tibia. The semitendinosus is also an excellent donor muscle suitable for use as a transferred muscle flap or myocutaneous flap. Clinically, it is often used to cover and repair ischial pressure sores or traumatic defects. 3. The semimembranosus is located deep the semitendinosus. Its upper part is a flat and thin aponeurosis, accounting for almost half of the muscle. The lower end of the muscle terminates at the posterior surface of the medial condyle of the tibia via a tendon. Function: the 3 muscles of the posterior group can flex the knee joint and extend the hip joint. When the knee is flexed, the biceps femoris can externally rotate the lower leg, while the semitendinosus and semimembranosus can internally rotate the lower leg. Dear students, in this class, we have learned about the thigh muscles. Next, we will start learning about the leg muscles. Thank you.